We're doing a little talk today about the benefits of a proper sleep study for children, and also linking that in on what relationship it may have to their malocclusion or their bad bite, right? So we have young Liam here today, and Liam's a classic example of a number of things. Number one, he's seen numerous dentists, and the dentists have been focusing purely on the teeth. And can you open up there for me? And you can see he's got all these stainless steel caps on his teeth due to possibly erosion or damage. But one of the things that dentists have got to understand is that some of that damage can also be caused by gastric reflux, and that's picked up in a sleep study, and the treatment of that could be multifactorial rather than just simply putting a crown on the teeth, right? The other thing is when a sleep study is done, they need to measure more than just whether the child has apnea or not. So we talk about the term sleep disordered breathing, and there's a number of things, restless leg syndrome, etc., mouth breathing itself, that can contribute.
He's very tired, very impulsive, very quite grumpy, agitated. Doesn't have a very good attention span. Yeah.
So I think all of that points to, so if you're a general dentist, rather than just look at the teeth, ask the right questions. What's the child's sleep like? What's his behavior like? What medication is he on? We can see the vertical maxillary excess, number one. Number two, you've seen all the damage in the mouth that is related to mouth breathing, i.e. lack of salivary flow, so more chance of cavities, etc., etc. Now, if we look at this young man's overbite, can you just bite together again for me? On your back teeth, you can see, back teeth, yeah? You can see it's 10 millimeters, okay? And in the old days of orthodontics, we would get those front teeth and we'd pull them back, because that would make his teeth look nicer. But what effect do you think that have on his airway? So if we look at his airway, we can see how narrow it is. Now, he's had adenoids and tonsils removed in the past when he was younger, but you can see there's clear regrowth of the adenoids here, and this area behind the soft palate, what we call the velopharynx, he's got a very long soft palate, his upper jaw's back, so you can see how narrow his opening is here. So the point is, we need to figure out what's going on with the sleep, and then maybe this will be a co-treatment of revisiting with the ear, nose and throat, possibly. Maybe he would need treatment for his reflux. There's a lot of relationship between reflux and constipation, etc., etc. But just from a jaw point of view, you can see this young man would need widening of his upper jaw. I mean, how else would you expect those teeth to ever come through? Number two, that lower jaw, once it's brought forward, we would have an improvement. Now, here's the big one. He's already seen someone that, of course, has looked at his tongue and says that he's not tongue-tied, and that's sort of the big debate nowadays in dentistry. What is the correct diagnosis of tongue-tie? So tongue-tie doesn't only affect speech, and the great paper by Larry Kotlow, which I'm happy to share with anyone, talks about tongue-tie contributing to blockage of the airway. So can I look at your tongue now? Ready? Good man? Okay. Open really big, as wide as you can go. Now try and lift your tongue up, and you can see he can't even get more than 50% of opening. So if we look at Audrey Yoon's classification, ideally the tip of the tongue should be able to go through here. Now just say ah, and when he says ah, look at the base of the tongue. Is that good? Yeah. Open really big, say ah, good on you, big ah. Look at the back of the tongue and see how it forms that shape. So we need to look at not just the anterior tongue tie. Everyone focuses. Just open again for me. Big ah, lift your tongue up. That's it. Everyone just focuses there on the frenum, okay? You could have a normal frenum and still have posterior tongue tie. So this is another thing that we need to look at. So this young man's seen everyone, I think, doesn't it? And yet, there needs to be a definitive treatment plan, and it's multidisciplinary. So we have Dr. Jim Papadopoulos, who does all my sleep studies, who will be able to work further as to what's going on during the sleep. We have his dentist here, Dr. Lena Castro, who was able to actually pick up the tongue tie and refer it on to me for the thing. So, I don't do tongue ties, so, I can't treat him myself. I don't do sleep studies. I don't do stainless steel crowns, but I do orthodontics. So multidisciplinary, Dr. Alina will do a very good release of his tongue. Dr. Papadopoulos will then rule out the other problems that we're going to discuss. Once all that's cleared, then I can get on with my job, which is to widen the jaw and to bring the lower jaw forward. Once we fix his bite, may root with the teeth, the job not done, because then we have to start work with Nada, who's my oral myologist. And what Nada will do is help this young man to retrain his tongue. For many years, his tongue's been down here, his jaw's been there. We're going to retrain his tongue to hit the palate, give some arch development, maintain what we've done.
In terms of the physical examination, no one's commented on whether his septum is straight or not, whether he's got signs of allergy. Also, he's got some ligaments laxity and low muscle tone. You can see that straight away. That fits with having gut issues and also predispose you to worse sleep apnea as well. So, this is a salad, and we've got to know what sort of salad it is. Is it a Caesar salad or a Greek salad? We've got to know what's in the salad. So, we can describe it better if we do proper measurements. And you've done your x-rays and so on. I think he needs a measurement of his sleeve.
Yeah, 100%. Yeah. Any questions from your perspective?
No, but he always has had issues with his stomach, so
Yeah.
I didn't even,
Issues, for sure, 100%.
I didn't even put that together.
Yeah, and that's the thing. And many people, when you start linking the signs and symptoms, the mum goes, oh, of course, these are one and everything. So I think that's why it's important for the approach to be multidisciplinary and holistic. The bottom line is we want this young man to be sleeping well and hopefully maybe reduce the dependency he might have on Ritalin, etc., etc. And lastly, of course, the bonus is straight teeth. But I think if I fix his breathing and get his facial balance right, the straight teeth are neither here nor there. And that's the important thing for orthodontists to realise. It's not about straight teeth. It's all about how this kid's going to do well. Some of the studies we'll talk about also relate to performance at school. You know, if the kid's not sleeping well, they're going to be hyperactive, they're not going to concentrate. And there's so many studies to show IQ performance on kids who've had sleep disordered breathing and those who haven't. So all this sort of thing, yeah. Okay. Do you want to ask us any questions?
I don't know.
All right. Good. Okay, good. Thanks.